Hello, everybody. My name is Dr. Muala. I'm a physician practicing in hospitalist medicine. I received my training in family medicine, and I wanted to begin a series of educational videos about things that are very pertinent to us and concern us in our everyday life. Many of the things are usually on the news and they perplex us and make us think about whether we or our families and friends are in any danger. As my first topic, I'd like to discuss the Zika virus because, as with everything, we are very afraid of things that we cannot see. And the great thing about medicine nowadays is we are so technologically advanced that we can figure out biological mechanisms of disease. However, the reality is, at the end of the day, it is nature taking its course and us trying to adapt to its virtual attack on human life. So, the Zika virus, as the name suggests, is a virus. Viruses cannot be seen with the naked eye. Viruses usually spread and in the human body, causing specific types of diseases. Of course, we're all aware of for example, influenza virus. We contract it by getting it from another person and then get symptoms of the flu. Similarly, Zika virus is a virus that is that is caused by a certain type of family of viruses called flaviviruses, which are born by mosquitoes. In other words, they live in mosquitoes, and then when they bite a human being, they inject those viruses into our bloodstreams. There have been outbreaks in Africa, Southeast Asia, as well as the islands in the Pacific. We've recently heard of outbreaks in South America, and it has even posed a threat to the upcoming Olympic Games in Brazil. So a mosquito basically bites a human and spreads the virus into his bloodstream or her bloodstream. And these bites usually occur during the day, and the mosquito usually breeds in standing water, usually man-made in nature, and therefore these are where the efforts are focused on prevention of the disease to begin with, by trying to either limit the spread of the mosquitoes or preventing getting bitten by one. So, to recap, Zika virus is a virus transmitted by a mosquito bite. We should be worried about mosquito bites wherever we go and try to prevent mosquito bites in every way we can. Insect repellents, nets for babies, nets for even adults. Any effort at trying to prevent the insect bite to begin with is better than cure. But let's say you do get bit by the mosquito. Mostly, what a person may feel is a low-grade fever, a rash. The rash is described as either macules or papules, so that means either it's raised or not. Like, so you'll either have bumps, like little pimple-looking things all over the body. Joint pain, so you'll feel some pain in your joints of the hand, the feet. Some people get irritation in their eyes, which we call conjunctivitis. So these four things, which is the fever, joint pain, irritation in the eyes, and rash. If you have two of these, it's a very high suspicion that you've been infected by the Zika virus. But as you can tell, it could be a host of other things, but our focus is on the Zika virus. Why? Because it has been linked to abnormal births, which makes it very pertinent for pregnant women. It has caused fetal demise, where a pregnant woman actually loses her child. And as with other viruses, there have been cases of Guillain-Barré syndrome, which is basically a paralysis. Your nerves get attacked by your own body, causing a paralysis that gradually spreads, usually from your feet upwards. So usually, if a person has been bitten by a mosquito, it takes about 2 to 14 days for it to manifest itself clinically, which means show you symptoms. Most people will not have any symptoms. About a quarter of people may have symptoms, so 1 out of 4, which, to be on the positive side, that means 3 out of 4, or 75%, nothing will happen to them. And again, the way we try to narrow it down is in areas endemic or known to have this problem, or the mosquitoes that we're talking about, and have these symptoms, then it's a very high suspicion that they contracted the virus. Now, practically speaking, what does that mean for us? Because once you're infected, there is no cure. It is usually a disease that is self-limited, and most of the medical treatment is geared toward symptom control until you clear the virus. Usually, for our purposes in the States, we test suspected patients using sophisticated technology that looks at the DNA of the virus itself. Actually, what it's going to be looking at is the RNA, but the genetic component testing is what I'm trying to focus on here, without getting into the details of DNA and RNA. So basically, we have specific tests that let us know that yes, this person has been subjected to a Zika virus infection. Basically, like I said before, the goal of knowing a person has Zika virus for our purposes is to let us prevent future infections by limiting the access of mosquitoes to biting humans. Also, another very worrisome finding is that there has been cases of sexual transmission of Zika virus. So basically, like with other viruses, there's either concentrations of virus in semen or in vaginal fluid that can lead to infection of the partner. This can happen with any form of sexual activity, whether it's oral, anal, vaginal. So condoms and other barrier methods are recommended. Men are encouraged to wait at least 6 months before having unprotected sex with their partners, and people that are asymptomatic but have been exposed are encouraged to abstain for about 8 weeks. So, to summarize, Zika virus should not create a panic. It is a viral-borne illness. that can have implications mostly for our purposes on pregnancy and pregnancy outcome. Therefore, ladies trying to get pregnant or uh, expecting to be pregnant should take extra measures when they go to areas that are known to be endemic to this virus and the mosquito that transmits it. Right now is mostly in South America, Africa, and, as previously stated, some islands of the Pacific. Many of us have to go to wherever we have to go, and we can't really change our plans. And therefore, at that time, it's very important to use insect repellents and the like to prevent the spread of disease. I hope you enjoyed this brief overview of Zika virus, and I'll be looking forward to any questions you have. My email is smuala@gmail.com, and I'll try to answer what I can. And please give me ideas for future topics that you would like me to discuss. Again, I thank you for your time and have a great day.